Hello and welcome to Let's Talk, a Tulsa World virtual town hall meeting. I'm Wayne Green, editorial pages editor of the Tulsa World. Today's town hall is graciously underwritten by the George Kaiser Family Foundation. Today we're going to be talking about plans to reopen public schools amid the continuing threat of the COVID-19 pandemic. Our guests are State Superintendent of Public Instruction, Joy Hoffmeister, and Tulsa Public Schools Superintendent, Deborah Gist. Welcome to both of you.
Thank you, Wayne.
Thank you, Wayne. It's great to be with you.
Our questions today come from our readers, and I want to get to as many of those as possible. But let's start with a quick recap of where we've been. In March, with COVID numbers rising in Oklahoma, the public schools shifted to a distance learning system. It was a quick transition that no one could have really planned for, and it took a lot of creativity to implement, and a bit of trial and error learning was involved. TPS and other school districts in the state completed the 2019-2020 school year successfully and now face the beginning of another school year with the novel coronavirus even more prevalent in the state and in Tulsa. Superintendent Hoffmeister, last month you put a graduated series of requirements for schools before the state school board. That it would have added more restrictions on districts and communities with higher infection levels. But the board members refused to mandate the rules, instead turning them into strong suggestions. Could you outline what those strong suggestions are for public schools?
Well, they cover a variety of areas from health safety protocols to instruction and how that's delivered, as well as the use of facilities, including sports and facilities for performances. And then just, I think, a more comprehensive look at how do we then respond to the different levels so that we didn't have a one size fits all approach all across the state, while there are, at the time, there were a number of counties that were still in the green level, which is the goal. Yellow being the caution zone, orange, the danger zone, and red, it's too late. We needed to respond much earlier. So it just put some specifics to that. And it did include a requirement for wearing masks in schools, both for students and for our teachers that serve and those who serve in schools. So
based on legitimate research, the higher the infection rate in your community, the more restrictions, or in this case, the more recommended steps are in place. So at a certain level, everyone needs to be wearing masks. At another level, you need to be moving to online only education. Right. And there are also restrictions on use of the school facilities for things other than school. So,
yes.
Superintendent Gist, Tulsa has some of the highest COVID numbers in the state, and it seems recently we've been setting new records on a daily basis. Facing that situation, last night, you asked the school board to take classes back to distance learning for at least the first 9 weeks of classes. What were the deciding factors in making that recommendation?
Well, I would say that we're very grateful to Superintendent Hoffmeister and her team for all of their incredible work in putting together the state's safety protocols that she was just describing. And those played a huge part of our decision making. I knew, because we've been in touch, and she does a great job of staying in touch with school districts all across the state, that they were working with the state epidemiologists, with top medical advisors in the state and beyond. That she has had conversations with the White House, the administration's coronavirus task force. Like they had the best possible information available to them in the development of that protocol. So we definitely used that information. We also, of course, worked very closely with our own medical advisors here in Tulsa, including Dr. Dart and his colleagues at the Tulsa Health Department, but also some medical advisors here in Tulsa, including a pediatric infectious disease specialist and people who are dealing with these kinds of diseases for both for children and for adults. And the reason why that's so important is not only do they have the expertise in sort of understanding the risks just because of their daily work, but also because of what's going on right now. They are reading the most up-to-date research studies that are coming out. They know how to discern among the ones that are higher quality and those that we may not actually be able to draw conclusions from. And so we relied on them as well. And I would also say that that the statement that came out from the Oklahoma chapter of the American Academy of Pediatrics and the Oklahoma Academy of Family Physicians was very helpful, because when you read when the American Academy of Pediatrics came out with their statement, and people interpreted it differently from if you read the whole thing, sort of the news about it was that they were saying kids need to be back in school for their safety and health. We all know kids need to be back in school for their safety and health. When you actually read that statement, it was much more nuanced than that. And it talked about that the local conditions have to be considered, and those numbers need to be in a good place in order for that to be able to happen. And so having the Oklahoma chapter come out and put out this very strong statement that left nobody wondering who was reading it what they really thought. And they shared a different data point, which is related to the data points that we have here in the state, but was very helpful to us because it really showed us in a very significant place. I'll just tell you the numbers. So what their recommendation is that we not return to school until we are in the green or yellow categories, and that ranges from 0 to 10 cases. And according to the scale that they're using, I posted all this on my Facebook page. Actually, I'll do it again. We're at more than 35 cases. So we're 3 times above what they say. And so that was another point to me, that as hard as this decision has been, you see something like that, as strong of a statement. And I think, well, who am I to go in defiance of these experts and do something that could be risking people's lives?
Okay, great. So I'd like to, based on some of the concerns I got from emails from readers in advance of this town hall, I think we should hear from both of you on how successful you thought the use of distance learning was this spring, and what lessons we can take into the next school year to make it more successful. Superintendent Hoffmeister, why don't you start on that?
Yes, I would just start by saying we don't want to repeat the delivery of distance learning that we had to do on an emergency basis with about a week's notice all across the state. That cannot happen again the way it was last spring. And that's not just Oklahoma, but my colleagues in other states that are also sharing that same kind of concern. But what has happened to change that is now, with federal relief dollars that did come in and some other resources through the CARES Act, we've been able to help districts, and we've seen districts make a really strategic and I think smart investment in rigorous coursework or learning platforms that can stand up a very different online or blended delivery of education for the long haul. And that's really what this summer has been about, is preparing to respond to the path of the virus in a much more rigorous way, one that is aligned with our academic standards and that has equity, where we can reach those students who did not have connectivity or have other barriers that prevented them. We're not going to be 100% where we need to be by any means. These are lingering problems with connectivity that can't be solved in a 3 or 4 month period. But we are making some really important strides on that front. But as far as the content of instruction that's going to be able to be provided for our districts, it's very competitive, and we're very, very pleased with what our districts have done with the funds that have been afforded for this time under COVID.
Dr. Gist, what did Tulsa Public learn from last spring that will allow us to do it better this fall?
Well, it's both what we learned last spring, but it's also what would we have done last spring if we actually had time. And as the superintendent said, it was within a matter of days that we stood all of this up, and we're feeding students through drive-through services, providing internet coursework, we distributed more than 20,000 Chromebooks to students, working to get students online, developing paper packets that we were delivering, having buses drive around delivering meals and paper packets. I mean, it was a Herculean effort, and our teams did a remarkable job, and our teachers do what they always do, which is step up, and they are creative and do what they can. But I think what a lot of people didn't completely realize is that our buildings were closed. So teachers literally left for spring break, and then suddenly they were teaching remotely. And so it was, as the superintendent said, they didn't have the resources. Even then, it would have been far different if we had had time to prepare. Now, because we've been working on this since that time, we have structured ourselves in a way that we're prepared for this. Because while we had three possibilities: an in-person, and of course with all of the hygiene and safety practices that needed to be in place, and a Wednesday distance learning day. The hybrid model, which we spent a tremendous amount of time and energy on, it's very, very complex to carry out. And then the distance learning. We not only was distance learning our third choice because we want our students in school as much as possible, I truly did not think until the last few weeks that a couple of weeks that we would have to end up making that recommendation. Is not what we wanted. But because both of the other models also had a distance learning component, we've been working on this part of it for weeks now. And to answer your question specifically about what we heard from families and what will be different, I mean, one very practical thing is just the way in which they access the system. There's one sign-on that gets them access to everything. And even students themselves will be able to do it. Even the littler ones will be able to do it seamlessly. And so that's one thing. And I think that there are a lot of other things that are different, that will be different. People should not be thinking about what happened in the spring as what's going to happen these first 9 weeks. It is not the same. We're going to, grades and attendance will be counted. There'll be a full school day of learning instead of an abbreviated day. That doesn't mean students looking at screens all day long, but the lessons and activities that would keep them engaged throughout the day. I don't want to, despite that, all of that work, we know the burden that this model places on families. And we really empathize with families about that. We wish there was a different recommendation that we could have made, but we are working with community-based organizations to make available the kind of safe places for students to be cared for, but also engage in their learning for families who aren't able to collaborate with other families or make other arrangements or work from home or those kinds of things. So that we are working on that as well.
You said that it was not what you wanted, it's what you had to do. Would it be fair to say that that online education, while it can be effective and you can do better, it can be done well, is not the optimum way to educate children? It's not the way that the school system is designed to work?
Well, I think for most students, so I took my first distance learning class in like 1997, I think, when I was in graduate school, and have taken many since then, and have worked on this kind of competency-based, using technology as a tool type of learning for years. And so I believe in it, and I believe it has a place. But for the idea of being completely online and being a part of an online school, and we have one at Tulsa Public Schools, the Tulsa Learning Academy, it is not for most students. It works for some students. It is not for most students. School for most students is about so much more than that content and what happens online. And they're there with their classmates, their teachers. The relationships are huge. What you learn socially and emotionally, the activities and the experience and the debates, and it's just about so much more than what happens from content on a screen. What we've been working on is how to embed those experiences in a distance learning environment. So we can't recreate school, but we can certainly do more than has ever been done before.
I suppose one of the things the kids lose in this whole process is socialization. That is, one of the things you learn in school is how to get along with other kids in school, right?
Definitely. And that speaks to the points that were made by the American Academy of Pediatrics. Just the overall development of children, the psychological development, the need to be with their peers. But we also know that there is a piece of this that touches on an area that we know exists in Oklahoma, and that our children experience trauma, neglect, abuse, and the reporting of that has gone down. It doesn't mean that the incidents have lowered. And this is another aspect to this that weighs on our minds and hearts as we make plans. And just to underscore what Dr. Gist said, the movement to online, we've planned for, prepared for, invested in, trained through professional development, those who will be serving and working with school children in this manner. But I don't think anyone in May thought we would be opening the school year this way. And that comes back to our community and state response. We have the power to crush this virus in Oklahoma with a simple mask if everyone will wear it. And it can simulate the effect of a vaccine with herd immunity if we all wear that mask. And so this is why, in my opinion, yes, local control for decisions at local school levels are very important. And we continue to believe in those who are closest to any problem have the best hope of solving it. But in a global pandemic or a public health event, it takes a state level response. And that is how we crush that virus. And we have these precious days in August now that are left. And they really will determine how we are able to move through the fall semester.
Do you have a sense at this point, Superintendent Hoffmeister, what portions of schools are going to be opening in person, or at least at this point are planning to open with face-to-face classes, and what portion are going to be either in a hybrid setting or in distance learning?
Some of those decisions are still being made, but I do think those districts that are serving the largest numbers of children are going to be forced to make a call now instead of closer to time, which means if we're looking at the numbers as they are today, it is very likely more of our districts will be moving to more virtual as a beginning to the year. But there are plenty of districts, if we go purely by the count of districts out of 540 that will be opening with an in-person delivery model. And they need to fight to keep that in place if they can keep community transmission lower. And I will say this, because more people are looking at the color code system county by county, whether they're looking at the state map or the map that we know are coming from Harvard or Johns Hopkins or other public health resources, the White House as well, and their task force, they are paying attention to what is happening locally and that data. And that is the first step in actually seeing positive change in lowering transmission. Have
you seen any schools announce plans to open, in-person classes? And you said to yourself, oh my gosh, that's a bad idea. That's a school district that really needs to be in an online setting.
I have greatest concerns where we see that surge occurring. And you can look at any of those heat maps and see where they are in the high upper level orange or red. And that is a very, very significant concern if they do not have a mask mandate particularly. I worry that they will not be able to stay open more than a few weeks. So that's the question that districts are facing right now. Do we launch into a virtual program with a lot of planning, or are we forced into it after we began a different path, and due to quarantine and those affected by the virus and exposed, we're forced then into a place where some classrooms are open, some are not. And then again, that local district has a decision to make about how they move forward from there that may be out of their control.
Whether these are rules or strong recommendations, you still have the authority to pick up a phone and call a superintendent and say,
Certainly.
hey, this is just not safe. You guys need to rethink this. Would you hesitate to do that?
No, and we are doing that. In fact, we are having weekly calls with the health department, the state health department, and asking, information about, is it institutional transmission, let's say in a prison, that is contributing to these numbers, or is it community spread? And then we're on the phone with those, particularly right now, I can tell you Jackson County, where Altus is located, is of deep concern with the highest level of transmission in the state. But yes, as we are fielding questions and working with those very important medical professionals like Dr. Gist mentioned, with the pediatricians and the family medicine physicians as well. These are groups that we will be staying in very close contact with. And definitely this is a day by day, week by week call, and yet we need stability. And I think that is leading to districts finding the only solution right now is to at least commit to online learning for at least 9 weeks.
Dr. Gist, the language I've heard used in reference to the recommendation that the Tulsa Public School Board adopted last night was that we would be in a distance learning mode for at least the first 9 weeks of the school year. What are you going to use to evaluate whether to go to a different system, 9 weeks down the line? And is that going to be a situation where you'll have to go back to the board for approval again, or is that something that Superintendent Gist can announce, however many weeks in advance, everyone come to school on this day?
So what I would say is that what the board approved last night was for us to be on distance learning for the first 9 weeks. And we wrestled with that, and we considered whether or not we started with a shorter period of time. The board meets every 2 weeks. Maybe we consider this and try to get the numbers to go down. We really felt like, for all the reasons that the superintendent is describing, that we needed to focus on the quality of this experience and make sure that people didn't feel like this was a pit stop, because the likelihood that it's going to go down that quickly is very, very low. Even if we all today start doing what we need to do, it's going to take at least a month, if not 8 weeks from now. So it's very, what we really hope to see is that part of the way through that first 9 weeks that our numbers will be moving rapidly in the opposite direction. And that would mean that I could bring to the board, and to answer your question, I will bring it to the board. It's not about whether I have to. I think this is so important that this is this is something that is of the magnitude that it's not one person who should be making the decision, but these are elected officials of our public school district. So together we'll make the decision about what that second 9 weeks looks like. And if it does start to go down sooner than that, and conditions are such that that we can get our students back before that, I would not hesitate to bring another recommendation to them before that. It's just that based on everything that we're hearing, the likelihood of that is very low.
So I'm sure that when you started this discussion, even before then, you're getting a lot of input from stakeholders, from parents, from teachers, from staff. Can you give us a sense of what was the push overwhelmingly in one direction or the other?
Yes, and I also want to make sure that I fully answered your last question about how we'll make that decision. So I think that from a family perspective, if someone is trying to watch this themselves and think, where do we need to be in order to be back? I think the best thing for them to watch is the guidelines that Superintendent Hoffmeister and her office put out with the state board, and those safety protocols that have the orange 1 and 2 and the yellow levels. And that we hope to be, if we were, toward the bottom of orange 1 and heading down, or definitely if we were in yellow, then I would not hesitate to be back in a hybrid. And then depending on where we are and all of that, hopefully back in person. What we will do for our recommendation will be much more complex than that, because we'll be looking at that data point, but we'll also be looking at other data points as well, including hospitalization rates and access to PPE and all these other kind of factors that we've been advised to consider. But generally speaking, I think that that's something that families could keep an eye on. In terms of reaching out to folks, so we, while we had limited ability to do that, and we're quickly learned that we actually can have a Zoom with 1,000 people, and we've had lots of those. We've done it, even though we had a really compressed period of time to be able to have really this kind of community engagement. But we have had these conversations with teachers, both in whole teacher meetings, but also with the teacher cabinet, our Tulsa Classroom Teachers Association delegates. We've had conversations with our other staff members, non-teacher staff members in the district, and then of course, families and students themselves. And that was both through surveys and also through these sort of Zoom type town hall conversations. To answer your question, I would say that people were much more strongly believing that we should be in distance learning or hybrid than I was expecting, because I understood the impact that this was going to have on people's lives. And that was changing as the numbers got higher and higher. So we first started having them at least 2 weeks ago, and then the more recent ones that we've had, then it definitely got higher. And we were asking people that because we wanted to understand where they were. But I don't want to give the impression that we believe that this was, fully representative of the district. That is, though, those who participated, that's what we heard from them.
Superintendent Hoffmeister, I'm going to put a question to you that directly, as a way it was emailed to me from an area school teacher who's concerned about schools that opt to have in-person classes. He asked, I would like to know, how are you going to make absolutely sure that the staff has enough personal protective equipment?
Well, this is a very big concern if we are having in-person class and delivery of instruction. We did petition the governor, and he did respond with a minimum starting point with the face shields and disposable, not disposable, excuse me, 2 different washable and reusable masks for every student and for every school, anyone serving in schools. But that's not going to go far enough if we are all back in school. And I think that's part of the question right now. Districts have been investing in PPE, and we have seen that. And we see those plans come through for how they will use their federal relief dollars. So there is at least that baseline provision that's in place now, and it will need to be addressed again if we see more of our districts back in school. So how will we make certain? For me, it would start with a requirement that they be worn. It can't be a $10 million suggestion that was invested in masks, PPE, face shields, gloves, and gowns. We need to have certainty that is uniformly applied if there is in-person learning.
I guess the money goes a little bit further if some of the larger school districts, Tulsa, Jenks, what have you, decide that they're going to be online. Am I correct?
Yes, it delays the need for additional PPE right now, other than they will have that PPE this month for those who will be in the schools. And we do expect our teachers to be in the buildings, which is again a contrast to the spring. They are able to be in their own classroom with district permission. And that is a difference, as well as the providing services for our special education students, for example, who really need to have that face-to-face support. And those who cannot be served in any other way, we did not, as a state board, make a recommendation that buildings be closed to even those students and those delivering the online instruction.
Superintendent, yes, I've heard from people suggesting that online learning is potentially well suited or better suited for most older students, but younger students and students with special needs don't connect as well online. They might lose attention faster and not make the progress that they need to make. What have we learned about making distance learning work for all the students?
Yes, well, I would say that generally speaking, I agree that that's true, but I actually think that even students 10 and older, depending on the student, their personality and their particular learning needs, it's, you know, that's not necessarily true. I know students of all ages either do really well with it or struggle with it. But as an early childhood educator, I can assure you that I fully understand that that our 4 and 5 and 6 and even 7-year-olds are going to have a different experience than our teenagers. And so we fortunately have a really amazing early childhood team in our office, and they have been working to make sure that the experience that students will have is that there are a series of different activities. There are going to be things that that students will have available to them, to manipulatives and things for them to be able to use to make sure that this is not children's of all ages, you know, just being on a screen all day, but are also developmentally appropriate activities for those students. And for our students with special needs, we actually have a call for, we have 3 of them this week for parents of children with special needs. We have one today, one Thursday evening, and then one on Friday in Spanish. And we're going to speak directly to their questions and concerns. We want to make sure that they know that we will be meeting the accommodations and supports that are laid out in each child's IEP. And for students who are at those much more significant kind of special needs, we do want to have those students and plan to have those students back in our buildings in small groups.
Superintendent Hoffmeister, I received an email from the husband of a public preschool teacher, a pre-K teacher, who conceded that he was offering more of an opinion than a question. And it went on at some length, more length than I could read here, but he raised some interesting challenges. He points to the recent research that shows that young children can carry a very high viral load of the coronavirus. And then here, I'll read a bit. Do you think for one moment that preschoolers understand or will comply with social distancing? Do you think they will stop touching each other, their toys and learning tools, their teachers, and then their faces? What can we offer this man, Superintendent Hoffmeister?
This is very, very important that we understand what those who are walking into school buildings are going to face. My own sister is teaching in an early childhood class as well. And I think about her, and I think about the fact that when we have face masks, and for that preschool teacher, also a face clear shield as well, so that you have that double protection, lots of hand washing, we can mitigate the risk. And that risk exists when we go out into a store as well. But right now, we're beginning to see more and more of the community wearing masks, and that is helping with reducing that spread around the community. It is still a concern. And when I was on a call yesterday with our large group of pediatricians and asked them, you know, their recommendation is for kindergarten through 12th grade to be wearing masks, facial coverings. And I asked, why not preschool? And they said, there's nothing wrong with preschool. Yes, but it's just that they need to be, taught, and then they learn, and they will be able to do that as well. So it should be something that we are striving for at all of our grade levels, and it can be done. I see moms and dads pushing carts at the grocery store with little preschoolers, and they have their mask on, and they are not taking it off. You know, they are able to keep a mask on. Yes, when they take them off, just like when they take their shoes off or their coat during the winter day, we put it back on. And there is a element to this that is part of the real life that we know your emailer describes, but we must have that more uniform approach to just that we are wearing masks, and little ones will follow the example of the adults and older children.
Mm-hmm. So part of the theme that I got from that same email was that the danger here isn't just to the students and to the teachers, but you know, it's to their families and to their anyone else in the community that they have contact with. And some of those people don't have strong immune systems that would allow them to handle infection. But what do you tell superintendents is their community responsibility as they face the decision of how to reopen their schools?
Well, it's first the safety and well-being of their students and those who serve in schools. That is their primary responsibility. And second comes learning. But we have to keep that as our first priority and obligation. That is why it is so important to not just look at one study, but to be leaning on those right here in Oklahoma who are public health officials that are looking at the data as well, and those nationally. But we need to make a collective decision when we're having to make those at the district level. Last spring, we took that off the table and said, close your buildings. We are not coming back after spring break. This is a novel virus that we've had for only a few weeks in our country. And no one had enough information to make any other decision except to close. We have now received much more data that can be studied. And what we do know about other countries that were able to successfully open and stay open, mask wearing was a key bedrock of their safety protocols, as well as the hand hygiene and in some cases social distancing. Others couldn't, but they were still able to be successful with wearing masks across all grade levels and with all people in buildings. Here's the difference. They didn't open when there was a surge in their community. They opened after there had been a decline and they reached down to that base level. And then there were weeks of no transmission. Then they opened. And so we are venturing into uncharted territory right now. And I'll come back to the first thing I said as I answered this. It is the most important responsibility of school leaders to put the safety and well-being of their children first, and those who serve in schools, balancing though the need to be moving education and learning forward and getting our kids back together as soon as possible.
We don't want to think about this possibility, but if things don't go well, is closing the schools again still an option out there for you?
It's always an option. I don't think it's going to be necessary because we have now such good information and districts are able to respond directly to what is happening around them. I think that we will see regional approaches that are very similar because of what is happening in regions. obviously we are not confined to our own bubble in a community. We move around, and that is something that will either spread that virus, or people will stay and restrict some of their own gatherings. And those kinds of behaviors will have an impact on our ability to have school. So I would have a plea to those right now who are living in communities where school districts are trying to open school, to recognize that their actions right now will make a difference on whether school can reopen, if not in the first 9 weeks after that.
Are targeted closings a possibility? If there's some school board that just will not do the right thing in the best interest of their children, can the state board step in and say, no, your district is not going to have in-person classes anymore?
Well, I wasn't afraid to make that recommendation before, and I won't hesitate again if that's needed.
Dr. Gist, I think you made reference to this earlier, but schools, as we all know, are not just about educating children. Sadly, a lot of times they're the most reliable source of physical safety and even food for some children. And for a lot of kids, it's the best source of adult guidance and motivation. That may not be what a lot of teachers signed up for when they took their jobs, but it's a reality. And it's got to be more difficult in a distance learning environment to meet all those needs. What are you telling your teachers to keep them motivated at the beginning of the school year?
You know, our teachers are motivated. They did get into this field because they have a passion for serving kids. They have a passion for changing the world, for making a difference in it. They are truly servants and servant leaders. And they want to be there to serve. So their enthusiasm is strong. We want to make sure that we're providing them with all the supports they need to be successful. And that includes the materials that are going to help them be successful in this new environment, the professional development so that they have all the background that they need to be able to use those tools successfully. We're also making sure that we have, because we put a priority on social emotional learning and a priority on parents, we have things that we're going to be able to help support our schools and our teachers with there as well. But to get back to sort of what you're saying, and your question is so true. I mean, we have, you know, I don't know if you know this, but the Superintendent Hoffmeister and I both started teaching first grade at the same year in the same district a long time ago. And when we were teaching, it was true then too, but it's grown increasingly more so. And that is particularly true in Oklahoma because we have, you know, failed to invest in our schools for decades now. And that has grown in the last decade, has gotten even more significantly true. And while we're grateful for the raises that our teachers have gotten, that was just catching up from years of neglect. But what we have not done yet is invest in our schools so that those kind of services that schools themselves offer now are falling on the shoulders of teachers. I mean, schools around the country have more counselors, they have social workers, they have nurses. In every single school, we have 6 nurses in Tulsa Public Schools. And I just don't think people realize that in other places you have a nurse in every single school. And so the shoulders, you know, get weighed down heavier and heavier. And then when we fail to invest in society, then that just gets, it just is a sort of a downward spiral in so many ways for the weights that we're putting on the shoulders of our teachers. They're strong, they're step up, but as a society, as leaders, it is our obligation to fight for them and beside them as we together fight for their children. And I think one thing that I can do is to continue being an advocate for them and for them to hear me say that we're never going to rest until we make sure that they have the resources they need to do their jobs well.
I want to thank our guests today, Oklahoma Superintendent of Public Instruction, Joy Hoffmeister, and Tulsa Public Schools Superintendent, Deborah Gist. He helped us understand a complicated and critically important issue. Thank you too to our viewers and to our sponsor, the George Kaiser Family Foundation. Please join us again for our next Tulsa World Let's Talk virtual town hall next Tuesday, when we'll be discussing another issue of high importance to Oklahomans. I'm Wayne Green, editorial pages editor of the Tulsa World. Goodbye for now.